I ran a business for 37 years that had so little technology in it until I finally, after repeated kind of not wanting to spend the money on it, have been such a believer that if you use it practically, it not only makes things more efficient, it makes things a lot less expensive too. So when I look to see that AI had come onto the scene, to me there are so many practical ways that we can use it to sift through the mundaneness of how you do it without it. And all I can tell you is if you drag your feet on it, you're going to regret it because your competition in the real world is going to use it and you're going to regret it. So based on that, I wanted to find something that currently is being done by CMS and give it the tools to do it better. So I'm introducing on November 16th and looking for a good Democratic lead. We'll get one, and I think this bill is going to go to town. It's called the Medicare Transaction Fraud Prevention Act. It'll direct CMS to conduct a pilot program of enhanced oversight for two categories of historically high fraud. That would be diagnostic testing and durable medical equipment. By notifying beneficiaries in real time with suspicious purchase alerts, this bill utilizes a successful technique that is already employed by private industry, like our leading credit card companies. It's that simple premise. So I want to ask Dr. Inglesby, what do you think of that idea? We know how much fraud is endemic to so much that government does. I'd like to remind everyone that when we spent nearly $1 trillion on the extended unemployment benefits during the CARES Act, the estimate is anywhere from $100 to $250 billion was stolen by domestic and international fraudsters. And when we're now borrowing $1 trillion every 6 months, and just 5 years ago, it was $1 trillion annually, I think we need to start doing some things that give taxpayers a better value. What do you think of this idea as a bill?
Well, and from what you've described, I haven't heard of this idea before. From what you described, it sounds like a very, very good idea. I'm very in favor of tools we can use to decrease fraud at CMS. I think we use very sophisticated tools in the private sector to detect indicators of fraud or checks. So if those tools can be used in a way that allow healthcare dollars to go to clinical care as opposed to some kind of fraud, I think I would be strongly in favor of that.
Thank you. Mr. Huberty, Hoosiers have been billed up to 20 times for like COVID tests. And this phantom billing of larger durable equipment like powered wheelchairs can involve huge co-payments to boot. What trends do you see in healthcare fraud, and how do you think that impacts seniors financially? And again, do you think a bill like mine would be the place to start, to where you weave it into the system to where it can even address larger stuff down the road?
I mean, everything that you've said absolutely is happening in terms of the billing fraud. There are programs. Wisconsin has a senior Medicare patrol program, and those are available nationwide to do just that, is to address those issues of fraud and detect and report those. So a bill that would be, that would focus in on that extremely. We can, we can avoid the wasteful spending and those fraudsters. I think to my testimony, though, what I'm getting at is that the AI, those companies are actually committing fraud on the other end, where they are taking Medicare dollars and not putting it back into the pockets of the patients by not offering the coverage that they said they were going to.
Thank you. And one final quick question for Dr. Sale. President Biden's executive order encourages innovation in healthcare services so long as AI models are tested robustly beforehand. The figure that we've talked about is way up there. What do you think? How would this impact a bill like this, taking into consideration what the administration has put out there as a caveat to make sure it's robustly tested, you think this would be a good place to start?
Thank you for the question. I do think robustly testing AI technology is important. I think we've been doing it in our own health system now for the better part of 2 years, trying to figure out how we can make ambient documentation support work and be successful for the rest of our physicians to use and use seamlessly. So I think anything that will allow us to, as clinicians, to make sure that we have input and guidance into new tools that we're deploying with patient care, I think are really important. And then safeguarding how we charge for those resources, I think is also important.
Thank you very much. And like I say, this bill will be introduced here shortly, and would love for all of you to weigh in on it beyond this kind of brief discussion of it. And I think it's a place to start to where we can build in what I think is going to be, in areas like this, something that's going to completely change the landscape, and it's going to save the government a ton of money. Thank you. I yield back.